10 years ago, I was treating hepatitis C at the University of New Mexico. We were the only large treatment site for hepatitis C in New Mexico at that time. Patients were driving hundreds of miles to see me. There was an 8-month wait to see me. If somebody was poor, they would have to make 12 to 18 trips to see me for one course of treatment. They just couldn't afford it. So very few people in New Mexico were getting treatment. They started coming to my clinic with liver cancers and liver failure, dying from liver disease. And it was kind of frustrating to feel that I knew how to do this, but there was no way to bring access to these patients who really needed it. ECHO stands for Extension for Community Healthcare Outcomes, and the mission is to expand access to best practice care for common chronic complex diseases for rural and underserved populations. Normally, only super specialists treat these very complex diseases like hepatitis C or rheumatoid arthritis. In Project ECHO, we can have a nurse practitioner or a primary care doctor treat a disease with the same effectiveness as a super specialist. And once we achieve that, force multiplication occurs. We use existing community clinicians and we make them as expert as us, and all of a sudden a massive capacity expansion occurs.
On 12/18/13, and she's a type 1, a 59-year-old female, type 1.
Every Wednesday afternoon, we have primary care clinicians. These are family doctors, nurse practitioners, or physician assistants from all over the state of New Mexico who will join in at 3 p.m. on an interactive video conference. One by one, they'll present patients to us and our experts. We'll have a psychiatrist in the room, we'll have a pharmacist in the room, and me as a liver specialist. And we will discuss those patients and help these primary care clinicians become experts in hepatitis C. As we do this, what we'll find is over time, these people will become more and more expert and they'll need us less and less. And this is when force multiplication occurs. They become almost as good as us and don't need us. For 3 months, it's a very good option if that's what you'd like to pursue. But you just watch the diabetes very closely or see if you can get better control, or also offer the option of potentially waiting. But I think the public policy implication of Project ECHO is that instead of thinking of an academic medical center just as someone who trains residents, fellows, medical students, and then sends them out into the community to practice and then learn on their own, there is a new challenge that is occurring, and that there's an explosion of medical knowledge occurring in the world. And it is very difficult for a doctor living in a rural area to keep up with this knowledge explosion. So we would like to see academic medical centers all over the world assume the role of maintaining the knowledge base and enhancing the expertise of doctors living in rural areas, urban areas, for the entire life of their practice. And that requires policy changes, but it has the potential to dramatically improve quality and reduce cost in our healthcare system.